For Albany.
I rise today to support the reasoned amendment and speak about healthcare delivery in Albany, across the Great Southern and indeed the whole of regional Western Australia. Because regional communities are becoming increasingly frustrated with a government that is very good at announcements but far less effective at long-term planning and delivery. The government will point to funding in this budget and expect regional communities to be grateful. But people in Albany are asking a much more important question. Why has the government continually waited until systems are under extreme pressure before finally acting? The issues facing Albany Health Campus are not new. The warning signs have been there for years. The population has been growing. Albany is one of the fastest growing regional centres in Western Australia. Yet, too often, our infrastructure funding still treats us like a town that has stopped growing. The reality on the ground tells a very different story. The region's population is ageing. Demand on emergency services has continued increasing. Work shortages have worsened. The staff at Albany Health Campus have continued carrying enormous pressure while the government repeatedly delayed the broader investment the community has been told we needed. In December of 21, there was a $320 to $340 million business case that was produced for the redevelopment of the Albany Health Campus. Despite years of promises and repeated acknowledgement that Albany's health infrastructure was already struggling to keep pace with demand, it has never been properly funded. That business case identified the scale of what was needed for Albany and the Great Southern moving forward. Yet despite all of that, the broader development has never eventuated. Instead, after years of delay, what the community has ultimately been given is a 32-bed modular ward dropped onto the site and presented as though it solves the problem. Yes, we acknowledge that additional beds are welcome. Regional communities are always grateful when they finally receive funding they've spent years fighting for. But let's be honest about this. A modular ward is not the same thing as delivering a long-term redevelopment and expansion Albany was originally led to believe was necessary. And when you dig deeper into the budget papers, the cracks start to show. We were told Albany's dental clinic expansion was being delivered, with glossy material promoting a $12.9 million project to the community. But the budget papers tell a different story. The actual allocation appears lower and most of the spending has already been pushed into future years. Anyone in Albany trying to access public dental services already knows the pressure the system is under. Long wait lists, delayed treatments and growing demand are not solved by re-announcing projects where the real funding keeps slipping further down the track. The same concerns exist in the mental health and alcohol and drug services. The government's own material says it continuing to deliver an adult residential rehabilitation and withdrawal service for the Great Southern. Yet it's not clearly identified $12.4 million allocation in this budget papers. That gives the community confidence this service is genuinely progressing. In a region dealing with increasing mental health challenges, family stress, addiction issues and growing population pressures, Albany cannot move forward on vague promises and broad statewide announcements dressed up as local delivery. Regional communities deserve transparency. Now it sounds like I'm choking. If projects are funded, show us the funding. If projects are delayed, be honest about the timeline. And if Albany is meant to be one of the government's so-called 7 cities, then our health services should reflect that ambition. Regional communities are tired of scaled-back delivery when being repackaged as transformational investment, because the reality is this: healthcare demand in Albany continues to grow faster than the government's willingness to properly plan for it. The government talks about 32-bed modular ward as though it has solved the problem once and for all, but staff on the ground know this is not true. The community knows it is not true, and anyone who's spent time speaking with healthcare workers in Albany knows the pressure inside the system remains significant. We continue hearing concerns about bed shortages. We continue hearing concerns about workforce strain. We continue seeing periods where hospitals is operating under enormous pressure. And every one of those issues becomes harder to manage when governments delay infrastructure investment for years and then attempt to catch up with temporary scaled-back solutions. The government also cannot separate healthcare delivery from the regional housing crisis. You cannot recruit healthcare workers if there is nowhere for them to live, and that is exactly what is happening in Albany right now. Nurses are competing for housing. Police officers are competing for housing. Teachers are competing for housing. And ordinary local families are competing for housing in the same market. The government continues pointing to grow housing announcements, but the reality is the promised housing stock for Albany would not even accommodate the additional staff associated with the modular ward, let alone the broader workforce needed across healthcare, education, policing and other essential government services in Albany. This is the reality regional communities are living with. The government wants Albany to grow. It promotes Albany under the 7 cities vision. It encourages regional populations to grow and economic expansion. But where is the matching investment in the essential services that support growing communities? Because you cannot continue pushing population growth into regional centres while failing to properly expand the health infrastructure and work capacities those communities rely on. Another issue that causes enormous disappointment for Albany is the closure of the hydrotherapy pool. And for the people sitting in Perth, that decision may sound relatively minor. But for the people recovering from surgery, living with chronic pain, managing disability or requiring rehabilitation services, this is not minor at all. The community engaged in good faith, people attended consultations, patients and clinicians contributed their views. There was a feasibility study. Then there was months and months of silence while the community waited for answers. Eventually they were told reopening the hydrotherapy pool was not financially viable, and understandably people in Albany look at the enormous amounts of money this government is spending on pet projects elsewhere and ask how regional hydrotherapy service could somehow be considered unaffordable. People have the right to ask that question, because regional communities are constantly told there is no money available for essential services while watching millions committed elsewhere. The Premier has indicated the feasibility study would be released and has just been received. I can assure this House that the Albany community will be reading that document very carefully, because the people want transparency. They want to understand how these decisions were reached, and they want to know whether regional communities are generally being given the same consideration as metropolitan Perth. There are also broader issues about how regional healthcare is treated in this state. Regional communities are constantly expected to wait for infrastructure, wait for workforce solutions, wait for upgrades, wait for delivery. Meanwhile, some projects in metropolitan Perth seem capable of moving from announcement to construction at extraordinary speed. No pun intended. Regional Western Australians are tired of being told to celebrate delayed or partial delivery as though it's some extraordinary achievement, and what they are tired of governments reacting years after problems become obvious. The pressure on Albany Health Campus did not appear overnight. The government knew this demand was coming, the health system knew this demand was coming, the community certainly knew this demand was coming. Yet meaningful investment continued being delayed until pressure became impossible to ignore. Albany is not a small regional isolated town asking for luxury. Albany is Western Australia's oldest community and major regional centre. It services communities right across the Great Southern. The government itself identifies Albany as a strategic growth city. More people are moving to the region. More families will be relying on regional healthcare services, and demand will only continue increasing into the future. That means healthcare planning cannot continue to be operating on a reactive cycle where government waits until systems are already under pressure and severe strain before finally stepping in. Regional communities deserve better than that. Healthcare workers deserve better than that. and the patients deserve better than that. Regional Western Australians are not asking for special treatment, but they are entitled to expect fairness. They are entitled to expect governments to properly plan for regional growth. They are entitled to expect healthcare infrastructure that keeps pace with demand, and they are entitled to expect honesty when projects are delayed, reduced or scaled back. Because at the moment, what many people in Albany see is a government that continues to underestimate the pressure facing regional healthcare while expecting regional communities to simply accept less. The people of Albany and the Great Southern deserve better than that.